Good evening, Los Angeles. We are all living through some of the toughest days of our lives. And I know that this is a summer unlike any that we've ever experienced here in Los Angeles. The sadness of this moment, the stress of these times, I know has built in our families and our communities and across our city. But even as our hope and our love for one another have helped us do what is right, we need to stay vigilant, to save lives and protect livelihoods. And thank you for everything you are doing every day to not only save the lives of strangers, but to look out for one another. And I hope you're looking out for yourself too. Our mental and our spiritual health is so critical. So every day, even in the midst of this pain, make sure that you're caring for those around you, inside your family and in your neighborhood, in your places of work, especially for our essential workers who still have showed up every single day to put on the boots, to wear the masks inside operating rooms, to get the storehouses and the shelves stocked up, to make sure each one of us can continue to get through this together. We have seen the sacrifices to protect one another, to help people in this city that we call home. And I'll cut to the chase. We are making progress. We are making good progress, Los Angeles, together. While our gains might feel slow and our future remains fragile, our success over the last 3 weeks is real. It's tangible, and it's reflected in our numbers. The promising signs are evidence that our daily actions of wearing masks and washing our hands, of keeping our distance and staying home, that these things work, and they are working to drive down the curve. Of the 6 important metrics that I follow every single day and that I share with you each evening at our data deck, which is available at coronavirus.lacity.org/data, so you can see the numbers that I see every single day. 5 of the 6 indicators that we track closely were all headed in the right direction yesterday, with the one exception being ICU beds, which we know remain strong and stable. This means we're seeing fewer cases, deaths, hospitalizations, a lower positivity rate, and stable and strong bed availability in our hospitals. But we have to remain vigilant. We have to keep going. We have to keep doing our part to stop the spread of this virus so we can continue down the road to health, to safety, and to economic recovery. And I know we can get there. We begin to see some signs of light, but we're doing everything we can to speed up the recovery and to take bold steps to lift up our communities in healing and in hope. So tonight, let me share the numbers with you, a couple important announcements as well, and share a story. Here's where things stand tonight in our fight against COVID-19. The county now estimates that the rate of transmission, sometimes referred to as the R0, is now at 0.86, down from 0.91 just last week. That means the average person who becomes infected is reinfecting 0.86, less than 1 person. And that's good news, because that will drive our caseload down over time. Our COVID-19 threat level remains at orange, but this still shows that our actions over the last few weeks have made a difference. And if we keep it up, we can take back control from this virus and bend the curve down further. So tonight, we can say confidently that we have no plans to move forward with any further closures or restrictions as these numbers continue to improve with your help. Our top public health goal has always been to ensure that there are enough hospital beds available to treat COVID-19 patients and anybody else who has a medical emergency. We've never had more COVID-19 patients than our hospital capacity, and that's good. And today we've made even further progress. Hospitalizations, as I mentioned, are down, currently across the county with 670 available beds, including 561 for acute care and 109 in our ICUs, as well as 1,200 available ventilators for anyone who gets COVID-19. The county today recorded 2,428 new infections, bringing our total to 214,197 total positive cases since this crisis started. And 851 of those cases were here in the city of Los Angeles, bringing the city's total to now 87,184 cases. Our 7-day average of new cases, because remember there's certain days that go up more and certain days down depending on when our data comes in, is about 2,134 cases each day. And that's down from the peaks we saw just 2 weeks ago. Important context here, too. As you've probably heard about and read about, the state of California's information technology system that counts the cases and passes them on was experiencing technical issues that affected data for counties across California. And though the state has let us all know that those issues are now resolved, we still are awaiting a backlog of some of those numbers here, and we believe that we've received just a fraction of some of those missing case data numbers. Once we get that data, we will know our case numbers will go up a little bit, and contact tracers will reach out to those new cases to ensure we know who those positive cases have been in contact with so we can ensure everyone's safety. And worst of all, the most tragic part of each one of these briefings is the 58 deaths that I share with you tonight that the county reported, bringing our total now well over 5,000 to 5,109 deaths in the county of Los Angeles since this crisis began. 15 of those were in the city of Los Angeles. And today we have folks that are hanging on to their lives and fighting valiantly, 476 patients in the ICU. This, luckily, is a 7.6% decrease from last month, a 5.9% decrease from just last week. To every family mourning and every family hanging on, know that we are with you. We've experienced that pain here, and we understand it. In fact, our Department of Building and Safety lost John Vasquez, a 30-year veteran of our Department of Building and Safety, many of whom are essential workers out there, ensuring we can continue building affordable housing and infrastructure. Many of our Department of Building and Safety workers have been afflicted, and almost all of them recovered. But John, who's 57 years old, who gave himself in service to this city, did not make it. And to his wife, Annette, to his daughter, Amanda, and his children, Anthony, Jasmine, and Faith, our heartfelt love goes to you tonight. Every day, we are learning more about COVID. We know that even those who have COVID but aren't showing symptoms still can have a lot of virus in their systems, in their bodies. And they can remain infectious for just as long as those who do have symptoms that we can see. It can spread, those folks who are asymptomatic, without symptoms, can spread the virus just as easily. This is why it was so important that Los Angeles became the first city in America, and still one of the few cities in America, to offer universal widespread testing to people with or without symptoms. And our data backs this up. This decision was the right one when we have 30% of all the cases we have diagnosed in our drive-through and walk-up centers coming from people without symptoms. When we know that 10% of people with symptoms can sometimes spread as much as 80% of the cases, we know how important it is to find those people who don't have symptoms, who we now know from research have high viral loads, and who can be infectious. Today, though, good news as well, the county estimates that 1 in 725 of us in Los Angeles County are currently infectious. That's down from last week where 1 in 510 Angelinos were estimated to be COVID positive. But we need to still keep assuming everybody around us has COVID. Act that way like you did at the beginning of this crisis. Keep your distance, wash your hands, put on your mask to protect yourself and others. And remember, we're safer in outdoor spaces and places with better ventilation. We also know that masks save lives. I'm wearing this great one that artist Barbara Kruger made, part of MoCA, our Contemporary Art Museum's mask series that they just put out. Whether it's a mask with a message or a mask with no words on it, every mask has a message that we want to care for each other and we want to save lives. And we know that masks don't just save lives, they save livelihoods, because the more we wear masks, the better chance we have to open more parts of our economy. In fact, a study recently showed that if every American wore a mask, the U.S. would save roughly $1 trillion. That's about $3,000 in savings for every American in this country. Masks will also help us get off the state watch list and get our kids back in the classroom, which I'll talk a little bit more about in a second. And as you know, since we launched the LA Mask Print Project, enlisting local artists to get that message out, more than 18,000 people have visited our website at coronavirus.lacity.org/maskart and downloaded some of the great images, placed them in their windows in their homes or their shops. And tonight we're unveiling the latest poster made by a local artist, by Studio Zavala, which is the design and art practice founded by Florencio Zavala, located in Northeast Los Angeles. This, which says, "No te olvides de tu nariz, mascarillas salvan vidas," is available for everybody, for free. And we thank the studio for offering this and designing this. There's some other great designs that are up there, so please check this out and post this wherever you live or where you work. In addition to wearing masks, we're also asking Angelenos to avoid gatherings. Last week, we saw some large parties in our city, the kind of gatherings that are extremely dangerous and can be the super spreader events responsible for a disproportionate amount of this spread. To keep Angelenos safe, I shared with you that I was announcing city policy that allowed the city to shut off DWP utility services at large gatherings or homes that are used over and over, rental homes for these things. And as always, we believe in the 3 E's. First, educate people to the rules. If they don't play by them, encourage them to do so. And then the third E, enforcement, is the last step, when people violate over and over that law or just thumb their nose in our direction. The good news is that the message has been received. We always think it's better to have the threat change behavior than the need to come down with a heavy hand at the beginning. And since our policy went into effect last Friday, we had a pretty quiet weekend. We've not had to move forward with any shutting off of utilities in residential settings. And our police and civilian employees continue to work well together, and I want to thank the public servants at LAPD and Department of Water and Power for working to prevent dangerous, large gatherings, to protect residents, and to save lives during this pandemic. You know, many people suspect that our collective behavior in 2 past holidays, on Memorial Day, when things began to ease up, and Independence Day on the 4th of July, contributed to the rise in cases that we saw last month. Thus, as Labor Day approaches, I want to get ahead of the curve to help us push down the curve. And I want to remind you, you should not host or attend unpermitted parties. They're unsafe, they're illegal, no one is immune, and these are settings, well, you might have an hour or 2 of fun that we literally have to all collectively pay for weeks and even months. I'll always give it to you straight. It's one of my promises to you since I've been doing these briefings, with good numbers and bad numbers, with the data that we get in and the advice we have from medical professionals and scientists. And as great as some of these improved data points are, we have our work still cut out for us. I said our collective goal, anybody who's a parent or grandparent, and certainly any young Angeleno knows, we want to get kids back in school. But that will require all of us to meet the state thresholds. Especially for our young children who we don't want to fall behind, we have to cut down our case rate even further. In fact, to get to 14 days in a row where the state could give us a waiver for our schools would require us to cut our case rate by more than 50% of what it is today. So good work where we've been able to cut that down by 20% or so in the last couple of weeks, but we've got to go further. And that should be our goal, 14 days with under 200 cases for every 10,000 people. If we can get that, we can see light at the end of the tunnel for parents and most importantly for our young Angelenos who can safely be in school once again. Testing, we know, has been a critical tool for us in keeping our community safe from COVID-19. So let me update you on our testing. So far, we've tested 1.6 million people in the county at our drive-through and walk-up centers. And the cumulative rate since the beginning of people who are testing positive stands at 9.9% in Los Angeles County. This number has remained steady over the last week, which is positive news. In the city of LA, we're even lower with the numbers that we have. Our drive-through and walk-up testing sites, where we've tested more than 1.118 million people. The cumulative rate of people testing positive stands at 7.2% in those city of LA testing centers. And that's also remained steady over the last week. As the summer heats up, we're making a couple adjustments to our testing program just for a couple days to keep our staff and volunteers safe in some of our hottest locations. So starting this Friday, all City of LA testing sites will run from 8 a.m. to 2 p.m. until the end of the summer. But daily testing capacity will remain the same. So we're not cutting down any tests, just the hours so that you don't have to be unsafe in a hot car, and our volunteers, of course, their health can be protected. The Hanson Dam and Warner Center sites will be closed this Thursday through Monday due to the high heat forecast, but we'll be making up the capacity to still have as many tests by boosting our capacity at Dodger Stadium, Crenshaw, and the VA to make up the difference. And we're also moving the location of our Echo Park walk-up site from Carbon Health across the street to Edendale Library. Beginning this Friday, the Edendale site will have the capacity to serve 400 people a day, half by appointment and half just as walk-ups, increasing our capacity in Echo Park by 300%. And to build on our efforts where we're bringing testing to you instead of you having to wait for it, tonight I can announce we are partnering with Metro to open yet another testing site next week at the 103rd Watts Towers Metro Station. We've done this in conjunction with the LA County City Commission of American Indians, Native Americans, working together because we've seen that the incidence among Native Angelenos is higher than the 10% average I mentioned, more like 12.4%, together with the Latinos who have a 14.2% positivity rate. We're bringing tests to the populations and communities that need them so we can make sure that this virus does not kill indiscriminately in certain cultural communities. So again, if you think you have been exposed to COVID, get tested. It's that simple. Ask a doctor for a test, get tested at a community health center, a city, county, or state site, at a CVS, and at city sites this week we have the capacity to test more than 18,000 people. And we're going to continue bringing our testing to our public housing developments until those are completed. We also are on our third round of our skilled nursing facility testing, which has been the strongest in the nation and gotten to us to every single one, cutting our deaths by 80% in the city of Los Angeles at those senior homes that we know were so deadly at the beginning. As we expand our testing capacity, though, we also need more volunteers to help us run these sites. Volunteers go through a short training, and they're fully equipped with PPE. I've done a shift at one of these testing centers, and you meet great people. You are safe, and you help us protect lives. So I hope you'll consider applying to become a volunteer at coronavirus.lacity.org/volunteer and join CORE and Los Angeles Fire Department and our partners to get that done. Thank you in advance for your help and your caring. We're also continuing to send those mobile teams to communities everywhere around Los Angeles. Today, the mobile team conducted testing at Pico Gardens Housing Development, and tonight we'll be at Ross Snyder Rec Center as part of our GRID program, our Youth Development Summer Nights Light Grab and Go program. So you can pick up meals, maybe get a little bit of programming there, and get yourself a free test. And tomorrow, mobile testing teams will be dispatched to 60th and Central, Wilmington Rec Center, and the Pueblo del Sol Housing Development. Tests are free for anyone, and we will also be at one of our pop-up testing sites, working together in a partnership with Fernandinho Tataviam Band of Mission Indians and the Puku Cultural Community Services at the San Fernando Recreation Park as well, to ensure, as I mentioned, we are reaching all populations. So to find any of these sites, please, as always, go to coronavirus.lacity.org/testing or just call us at 311 and we'll set up an appointment or get you the information you need. And one last thing, remember, if somebody calls you from the County Department of Public Health, who's part of the contact tracing team, county, state, and city employees that are together, we need you to answer the phone. And as you may have heard, there's an extra incentive if you complete the entire interview. These interviews, I know, aren't quick. It's not a couple minutes. They can last 40 minutes or a little bit longer. But they help us get to everybody who is in your circle to make sure they are safe. And now, thanks to the county, you get a $20 reward, a gift card for completing a contact tracing interview. This has already helped double the number of people that are going all the way to the end of these interviews and helping us get many more contacts that we can trace and contact. Contact tracing is one of our most critical tools in our fight against COVID-19. So if you pick up the phone, we can give you the information that you need to stay safe and to slow the spread of the virus. Remember, again, contact tracers are not law enforcement. They're not going to ask you your immigration status. They're only here to protect all of us. And our testing and tracing is built on a very simple idea. The more we know and the faster that we know it, the quicker we can see a reduction in our positivity rate and fewer cases in LA. The tests so far, though, that we've been deploying in Los Angeles, and I want to share with you a kind of an exciting announcement of something we're moving forward with tonight. The tests we've been using at all the drive-through centers that your doctor orders for you are what's called Pcr tests. They are the diagnostic gold standard, so sensitive they can detect even tiny traces of the virus. And they've allowed us to screen over 1 million people in Los Angeles for COVID-19, to deliver results in an average of 30 hours and sometimes even sooner, same day, and do it all with virtually no strategy or support from the federal government. Our testing infrastructure, no question, has made a huge difference, and I'm so proud that LA City and LA County have taken the bull by the horns and built this up here in Los Angeles for ourselves. While other parts of the country are waiting for test results for sometimes 10 days, here we're getting quick turnaround. Here we have a local Southern California company with Curative doing the bulk of those tests, and I want to thank them. But we still need to go further. We need to ramp up more testing, and we need to get results even faster. We need to stay a step ahead of outbreaks and identify outbreaks more quickly. One recent study showed that when contact tracing begins at the onset of symptoms, 80% of future infections could be prevented. In other words, that R0, that infection rate that I mentioned of 0.86, could be driven down quickly in a matter of days instead of weeks. There are clear and emerging ways to reach that point, and one of the most promising things that we are monitoring and taking leadership on nationally is test strips, which can either be in place or, in some cases, rapid at-home testing. It's an innovative tool to radically increase virus detection. Now, at this stage, these tests, which as opposed to the $100 to $200 cost of a PCR test, it's estimated could be manufactured for as little as $5 or $10. They're still in development, and the FDA has not cleared the regulatory hurdles that need to be removed before this technology can reach millions of Americans, including here in LA at a lower cost. But this is not the time to wait around for the federal government. We need action right now. So tonight I'm announcing that we have convened a national group of scientific experts, bioscience firms, government leaders, and foundations to explore rapid at-home testing and to work together to accelerate the research, the development, and the production of these tests. Last week, I brought together this group for the first time. It's a grassroots effort to accelerate the science of testing so that we can know where outbreaks are quickly and within days bring those numbers down, and potentially quickly get our children back to school, having daily tests for workers, teachers, and students who could see the results and know if they are infectious. In the coming weeks, our coalition, which is working closely with the U.S. Conference of Mayors and the National Governors Association, will accelerate research on the cost and volume of testing and put our resources forward, if necessary, to make sure that there is the manufacture of these testing. We're going to urge the FDA and the CDC to clear the obstacles standing in the way, and working with local partners like USC, we will have pilot tests that we can see here in our city and county to show the efficacy of these tests, and to make sure that communities across the county benefit from these advances. But at the same time, we're calling on the administration and our federal government and both parties in Congress to work together and to mandate insurance coverage for rapid test strips nationwide so we can be reimbursed for these. To put this in perspective, as I mentioned, we've done 1.1 million tests so far through city testing centers. If we get this right, we could be doing as many as 1 million tests a week using paper strip testing here just in Los Angeles alone. We need help, though, to allow states and cities to purchase this critical tool at scale. It still may be some weeks or even a couple months off, but we need to find even better solutions now, and as always, LA will lead. There's many resources available to Angelenos who are experiencing extreme economic hardship, but actually getting those benefits into your hands, as we know, can be a confusing and inaccessible process. And that's why we are here to help. While we're pushing forward with helping with science and testing, we know the economic burden that you are facing is something that you see every day. So tonight I'm announcing LA Connected, a new streamlined effort to connect struggling Angelenos with the critical resources they need to stay afloat. LA Connected will be the bridge between the tens of thousands of working households and the tools they need to make rent, to pay the bills, and to put food on the table. So if you've lost much or all of your income, LA Connected will work with you to determine what's available, from federal stimulus checks known as economic impact statements, to unemployment insurance, income tax credits, and banking resources. The city of Los Angeles often doesn't control where those fund sources come from, but we know you need navigation help. You need someone on your side who can call the state or call the county or help at the federal level to make sure you get what you deserve. So to help you navigate these programs and access this critical relief, I've activated the city's 16 work source centers and 16 family source centers to provide the support you need in person or over the phone. And to ensure that communities who have been hit the hardest have access to these resources, we are working with local nonprofit partners and have set up an information hub online at laconnected.la. That's laconnected.la. In recent days, we've experienced so much loss. More than 10,000 Californians who have now been taken by this virus. More than 165,000 Americans dead at the hands of COVID-19. These aren't lines on the graph. They're human beings with lives and loves. They're people like Bernard Zelkowicz. Bernard was born in what was then Czechoslovakia in 1925. He was raised in an Orthodox Jewish home. And in around 1940, his life began to change. He could no longer go to school or be outside after 6 p.m. and was forced to wear a yellow star sewn onto his shirt, all because he was Jewish. At 17, he was forced out of his home and into a ghetto with his parents and sister, and a year later, they were forced to move again, this time to a concentration camp. Their destination was Auschwitz. When they arrived there, Bernard was separated from his family, and that's the last he ever saw of them. For the next 6 weeks, like so many that were in those concentration camps, the Nazis tried to break Bernard through forced labor, but he did not break. He survived. He was soon moved to another camp, and as the war drew to a close and the Nazis were forced into retreat, they brought prisoners like Bernard on them, a 6-week march, a death march that claimed so many, and where if you stopped or stepped out of line, you would be shot. Bernard, again, did not die. He survived, only to be placed in yet another concentration camp, this time Bergen-Belsen. There was no food there, and this time the Nazis soon fled, leaving only Hungarian soldiers in charge. Americans and British soldiers closed in, and within days they were liberated. And while Bernard had survived, so many others had not. He lost 56 members of his family. After the war, he settled in Israel, where he met his wife Carmela and had daughters. And eventually, they moved here to Southern California, to Temecula, and made a home. Despite all that he experienced, Bernard never hated anyone. He knew that the answer to an act of evil was exactly the opposite. To be always, in his word, quote, good to one another and to love one another. You've heard me talk so much about LA love each evening when I've had these addresses, and Bernard embodied that as much as anybody. That was his task to all of us, and we must continue to honor his legacy by leading through this with love. While he was taken from us because of COVID-19, I have a message for Bernard's family, to his daughters Renee and Jeanette, to his 6 grandchildren, that we share your grief and send you our love during this most impossible moment. You see, the story of Bernard is not a statistic. It is part of who we are. And those of so many Angelinos we mourn across our city. And again, I reach out to my brother, Mayor Robert Garcia, who lost his stepfather after just losing his mother. We draw a lesson, a universal lesson from this moment of pain and suffering, that even when the world is dark, even when things feel uncertain, we cannot let ourselves be powerless. We cannot surrender to that darkness. We must be that light. We must show that strength. We must summon our courage, and we must do what's right to continue to protect this, our Los Angeles, our America, and everyone on this earth. So in these critical days for our city, let's never grow weary of being there for one another, of knowing that the brave men and women who came before us, who fought wars and stood up for civil rights, whose lives were taken too early for all sorts of reasons, that this is our moment and our test and our time to rise to this day. So let's keep washing our hands and wearing our masks and avoiding gatherings, and keep leaning into the actions that slow the spread of the virus and that save the lives of our loved ones. We are strong, Los Angeles, and we are resilient, and we will get through this together. So stay safe and stay healthy, and whenever possible, stay at home. Strength and love, Los Angeles. With that, happy to answer questions. And as always, I'll speak in Spanish after that. First question, please.
Thank you. And that comes from Elizabeth Cho from the LA Daily News. Please go ahead.
Hi, Liz.
Hi, Mayor. I have a couple questions. The first is I was wondering how the city is handling the placement of people in the bridge home and other kind of interim congregate setting shelters, especially if someone tests positive and a quarantine has to happen. I've heard that this has slowed down the placement of people at a shelter, and the quarantine process itself can place some limiting restrictions on what people can do at the shelters. So I wanted to kind of get a sense of how these types of situations are handled. The second question I have is the Street Watch LA group posted about a comprehensive cleanup near the Hollywood Bridge Home site, and it looks like the way that they're describing it is that people are being forced to take down their tents and move, and that if they have their tents there and they're not there, sanitation destroys them, and also that a lot of people are not aware that there was going to be a cleanup that day. So I just want to get your thoughts on what appears to have happened based on this report. The police also appeared to be there. There's a picture of a sanitation worker, or someone who appears to be a sanitation worker, flanked by two officers, crouched near a tent.
Okay, thank you. That's
a
lot. I'll try to get to all of that. Thank you for both questions, Liz, and good to hear your voice again. There are protocols in place. We're happy to send them to you, and they are abided by. Working with local council offices and abiding by public health direction. There are cleanups, but they are not sweeping people out. They are ones that are posted so that there's advance notice. There's outreach ahead of time, and people can come back. But for their own safety, first and foremost, because of the need to be able to clean those areas and make sure that these aren't places that can spread COVID or any other diseases. This is something necessary from public health. But it's done, and it's been something that has evolved in consultation with advocates, with communities, and these are not easy things to do, but the Care Plus teams are out there. They're not led by police officers, but where there's any threat to public safety, like for any city employee, of course, law enforcement is available, but it's not law enforcement that mandates, that moves forward, that leads them, or that decides when they're happening. That happens through council offices directly. As to the first one, the congregate shelters, no, we early on had a couple outbreaks. They were dealt with quickly. There wasn't massive spread. We made sure no people were coming in, but no, that has nothing to do with why the congregate shelters are increasingly having fewer and fewer people. Those were always going to be temporary. Over time, we've moved more and more people out of those into either housing solutions and or hotel and motel rooms. So there's still, some of them that are open. So there's still quite a few trailers. I think total there's about 400 people between those two, between trailers and in the city-run congregate shelters that are in our rec centers. But the other thing that's happened is we've opened a lot of bridge home shelters. While I've been doing these briefings and dealing with COVID-19, we now have 21 bridge home shelters with over 1,700 new beds. So we've moved some people from those into the new shelters. And as always, those bridge shelters, which are really set up for the long haul, always with the Department of Public Health so that we have the right protocols, are doing really an excellent job. In fact, that's why both our positivity rate and our mortality rate is lower among Angelenos experiencing homelessness than those of us who are housed, something I'm very proud of. And we're going to stay vigilant, whether it's bringing tests to people who are living on the streets in Skid Row and other places, or which is over 17,000 tests, I think, and counting, if I'm not mistaken, or setting up more and more beds. Look, whether it's encampments and cleanups, or whether it is looking at COVID-19, beds save lives. And so 1,265 permanent beds will open up in the next 5 or 6 months. As I mentioned, over 1,700 beds, and I think there are 4 more openings this month alone of bridge home shelters. And I just want to thank every city council member who's opened a bridge home, and in some cases 2 or 3 in their district. It's really difficult work. It's really impressive work. And I also want to thank our city staff that is building these in about 4 months at a time. And again, remember, these beds can turn over. So if they have 100 beds, that means 200 beds when a new round comes in, 300 beds. And over a 2 or 3 year process, we can have hundreds of people in each one of these finding solutions off the street. Thanks, Liz. Next question.
Thank you. And that comes from Emily Albert Reyes from the
Hey,
LA
Emily.
Times. Please go ahead.
Good evening, Emily.
Hi, Mayor. How are you doing?
Good. Yourself?
Good, good. I had a question about short-term rental enforcement. My understanding is that the mayor's office asked to hold off on implementing the API system for Airbnb enforcement because it was concerned about checking the financial effects, and that planning had since then sent in a report that says that they don't think it'll affect transient occupancy tax revenue. In light of that response from planning, why hasn't the API system gone into effect, and is there a plan for it to do so at any particular date?
I'm sorry, I'm having a little trouble hearing you on this. I think what you asked about short-term rental, like some of the detail, I didn't hear of that, but the mayor's office instructed what?
I was asking about the API system for Airbnb enforcement, and my understanding is that the mayor's office asked for it to be put on hold because of concern about the financial impact of implementing the system. Planning has since responded with a report saying that they don't anticipate any effect on transient occupancy tax. In light of that, why hasn't the API system gone into effect?
I don't know, and I've not heard that. I certainly have not instructed. So let me get back to you on that, Emily. We have not instructed for financial reasons not to do that. I mean, always, in a tough budget year, it may be that we need to find, I mean, literally there's cash flow week-to-week issues, so there may have been something temporary. But let me research and get back to you because I don't know. Okay? I promise we'll get back to you tonight. Any other questions? Okay. I'm informed that's the last question, Emily. I promise we'll get you answers on that. Thank you to everybody, as always, for tuning in and for doing your part. I'm going to switch over to Spanish, and thank you, everybody, for tuning in. Be safe and have a good evening. Muy buenas tardes, Los Ángeles, y gracias por venir esta noche. Estos días han sido difíciles y hemos hecho sacrificios para proteger a nuestras comunidades. Y como resultado, hemos avanzado en nuestra lucha, gracias a sus acciones y nuestras acciones colectivas. Tenemos que mantener nuestros esfuerzos para detener la propagación del virus, para que podamos lograr una comunidad segura y saludable. El condado ahora estima que la tasa de infección está al 0.86, ha bajado del 0.91 de la semana pasada. Buen trabajo. Mientras nuestro nivel de riesgo se mantiene en anaranjado, esto muestra que nuestros esfuerzos han tenido un impacto. Si lo mantenemos, podremos tomar control de nuevo del virus y aplanar la curva. Entonces, hoy podemos asegurar que no tenemos planes para implementar ni cierres ni restricciones adicionales mientras siguen mejorando estos números. El número de hospitalizaciones ha bajado y nuestro inventario de hospitales está estable. En el condado hay 670 camas disponibles, incluyendo 561 de cuidados agudos y 109 camas de cuidados intensivos. Y hay 1,200 respiradores. Hoy el condado nos informó de 2,428 nuevas infecciones, llegando a un total de 214,197. Y 851 de estos casos están en la ciudad de Los Ángeles, llegando a un total de 87,184 casos. Es importante notar que algunos problemas técnicos del sistema de informática del Estado han afectado a los datos del condado. Por eso el condado espera recibir los datos completos. Cuando recibimos estos datos, sabemos que el número de casos va a subir y los rastreadores de contacto se pondrán en contacto con las personas positivas. Y trágicamente, el condado también reportó 58 fallecidos hoy, llegando a un total de 5,109. 15 de ellos están en la ciudad de Los Ángeles. Hoy tenemos a 476 pacientes en unidad de cuidados intensivos, una reducción del 7.6% del mes pasado y del 5.9% de la semana pasada. Los datos siguen estabilizando la prueba de que nuestras acciones tienen un impacto. Pero este progreso es delicado y tenemos que mantener nuestro trabajo para aplanar la curva. Tenemos que asumir que todos pueden estar infectados con el virus y recuerda que estamos más seguros en lugares al aire libre y lugares con mejor ventilación. Sabemos que las mascarillas pueden salvar vidas y pueden evitar hasta el 80% de la transmisión del COVID. Y también pueden salvar sustentos de vida. Entre más usemos mascarillas, más pronto podremos abrir la economía y proteger más trabajos. Un análisis muestra que si cada residente de nuestro país usa una mascarilla, nuestro país podría ahorrar cerca de $1 billón de dólares, alrededor de $3,000 por cada persona en el país. El uso de las mascarillas también nos permitirá abrir las aulas en nuestras escuelas de nuevo. Como un padre y por todos los padres y las madres, este es muy, muy importante. Desde que lanzamos el proyecto artístico de mascarillas, LA en julio, más de 18,000 personas han visitado nuestra página web para bajar el diseño original del Studio No. 1. Y esta noche revelamos otra obra diseñada por el Estudio Zavala, fundado por Florencio Zavala, basado en el noreste de Los Ángeles. Puedes bajar este diseño en la página coronavirus.lacity.org/maskart para que negocios y hogares lo muestren en sus ventanas. Dice, no te olvidas de su nariz. Mascarillas salvan vidas. Es para usted, por favor, toma este. Y además de usar mascarilla, les pedimos que eviten reuniones. La semana pasada vimos fiestas grandes en Los Ángeles, el tipo de fiesta que es muy, muy peligrosa durante una pandemia, donde el virus puede fácilmente propagarse. Anuncié una nueva póliza municipal que permite que la ciudad apague los servicios de agua y energía en lugares donde hay fiestas grandes. Desde que anunciamos eso, no hemos implementado ningún corte. El mensaje ha sido recibido. Les recuerdo que no deben organizar ni participar en ninguna fiesta. Son ilegales y no son seguros. Todos tenemos la responsabilidad de proteger a la salud de nuestra comunidad. Hasta hoy en el condado, 1.6 millones de personas se han hecho la prueba y la tasa de personas positivas es 9.9%. En los sitios de prueba de la ciudad de Los Ángeles, le hemos hecho la prueba a más de 1.118.000 personas y nuestra tasa de personas positivas es 7.2% en la ciudad de Los Ángeles. Con el aumento de calor del verano, estamos ajustando las horas en nuestros sitios de pruebas para asegurar la seguridad de nuestros voluntarios. Empezando el viernes, los sitios de la ciudad de Los Ángeles estarán en operación entre a las 8 de la mañana a las 2 de la tarde hasta el final del verano. Cerraremos los sitios en Hanson Dam y Warner Center del jueves al lunes debido a las altas temperaturas previstas para este fin de semana. Y aumentaremos capacidad en los sitios de Dodger Stadium, Crenshaw y la Administración de Veteranos durante estos días. No hay una reducción de las pruebas disponibles, pero un cambio en las locaciones. También estamos moviendo nuestros sitios de pruebas en Echo Park a la Biblioteca Edendale. Empezando este viernes, este sitio tendrá la capacidad de hacerle la prueba a 400 personas al día. Y hoy estoy anunciando una nueva colaboración con Metro para abrir otro sitio de pruebas la semana entrante en la estación de calle 103 y Watts Towers, donde también podremos hacerle la prueba a 400 personas al día, con o sin cita. Mientras ampliamos nuestra capacidad de hacer pruebas, necesitamos más voluntarios para ayudarnos a operar estos sitios. Les alentó a considerar la oportunidad de salvar vidas con ser voluntario en este esfuerzo. Visita coronavirus.lacity.org/volunteer para aprender más y gracias por su participación. Además, estamos enviando equipos móviles de pruebas a comunidades por toda la ciudad donde hay mayor necesidad. Tenemos pruebas mañana en la calle 60 y Central, el Centro Recreativo de Wilmington y las viviendas Pueblo del Sol. Si piensa que ha sido expuesto al COVID-19, hágase la prueba. Tenemos capacidad diaria para hacerle la prueba a más de 18,000 personas al día. La prueba es gratis. Visita nuestro sitio web para encontrar un sitio para hacerse la prueba. coronavirus.lacity.org/testing. O puede llamar a 311. Y recuerde, si recibe una llamada de los rastreadores de contactos del condado, por favor, responde. Es importante. El rastreo de contactos es una herramienta muy importante para detener el virus. No son agentes de la ley y no le preguntarán sobre su estatus migratorio. Y cuando usted complete esta entrevista, tú puedes recibir una carta de regalo de $20. Por favor, participa en este movimiento. Nuestra infraestructura para realizar pruebas ha tenido un gran impacto, pero no es suficiente. Tenemos que realizar más pruebas para estar delante del virus. La herramienta innovadora para ampliar estos esfuerzos es la tira de prueba para hacer pruebas rápidas en casa. Mientras el gobierno federal todavía no ha eliminado las barreras regulatorias para permitir que esta tecnología sea disponible para millones de americanos a un precio más bajo, no estamos esperando en Los Ángeles. Estamos tomando acción ahora. Hoy estoy anunciando que he organizado un grupo de expertos científicos, líderes gubernamentales y empresas de biociencia para explorar esta innovación y acelerar la investigación, el desarrollo y la producción de estas pruebas. Este grupo se reunió la semana pasada y con el apoyo de la Conferencia Nacional de Alcaldes, le pedimos a la Administración y al Congreso que tomen acción para exigir que las compañías de seguro de salud cubran el costo de estas pruebas para todos y ayudar a los estados y a las ciudades en comprarlas. Además, hoy estoy anunciando LA Connected, un esfuerzo para conectar a angelinos con los recursos que necesitan para superar las dificultades que están pasando ahora. LA Connected trabajará con usted y su familia para determinar cuáles recursos están disponibles y navegar los programas para hacerlos, como seguro de desempleo, créditos tributarios, recursos financieros. He activado a nuestros centros de recursos familiares y centros de recursos de empleo en la ciudad para ofrecer el apoyo que necesita, por teléfono o en persona. Para más información, visita laconnected.la. Hemos sufrido una gran pérdida de vida por este virus. Más de 166,000 americanos y más de 10,000 californianos. Estas son personas con vidas y con seres queridos. Por eso, en estos días críticos, les pido que hagamos todo lo posible para protegernos el uno al otro. Quédense protegidos y quédense en buena salud. Y quédense en casa. Mucha fuerza y mucho amor. Gracias, Los Ángeles, y hasta pronto. Thank you all.